Hi everyone, Dr. Chiam here. So we are seeing a little bit more of this phenomenon of patients calling up the clinic and asking for specific laser machines like laser A, laser B, or even products, product C and product D, because they might have heard of this machine from social media or from a famous influencer, or even read about it in an article online. So I would like to address this phenomenon of calling clinics up to ask for particular machines, because I feel that it is something that's potentially dangerous, and I would like to give you a little bit of an outline what you should really be asking your clinic when you call them up. So imagine if you were making a booking for a restaurant for dinner this weekend. Would you call up the restaurant to ask, hi there, do you have a Yosper grill? Because that would be a very strange question to ask a restaurant, because the cooking apparatus does not make the chef, neither does the cooking apparatus make the cuisine that you desire out of the restaurant. The real question you should be asking yourself when you make a restaurant booking should be, what cuisine do they serve? Is it Italian, Japanese, or Mediterranean, for example? And who is the chef executing this cuisine? That will make for a more complete experience at the restaurant. It's also important what you feel like eating at the restaurant. So in the same vein, when you call up an aesthetic clinic, it's not so important what machine is present at the clinic. It's more important whether the clinic has experience dealing with the condition or the concern that you may have, whether the doctor is experienced and at dealing with such conditions, and whether he has proposed some solutions that are reasonable or good to you. Only after all this do we ask ourselves the question whether he has the equipment or the machines to execute his plan for you. So the problem with chasing the machine and the product rather than the solution or the doctor is that you probably end up with a lot of disappointment and potentially complications. For example, if you were to chase the latest laser machine and call up a clinic and say you want to do a treatment with the latest laser machine, this particular laser machine may not be suitable for your condition. So for example, if you have uncontrolled melasma, for example, and you were to do a laser machine that is too strong for your melasma condition, you'll probably end up with worsening melasma, or with a lot of downtime that is very undesirable in the modern lifestyle. So I feel that chasing the machine or the product probably leads to more disappointment as well as complications, compared to having a good discussion with your doctor about potential options for your concerns. So in summary, what should you really be asking when you call up an aesthetic clinic, for example? So I think the first point, the most important point, is be very clear what your concerns are. So if you have concerns such as pigmentation or open pores, pimples, for example, make it very clear to the clinic that this is what your main concerns are. The next thing you should be asking the aesthetic clinic is whether the doctor is experienced with dealing with such conditions. And of course, the third thing is have a listen to the person on the other end of the line, at what potential options they have at the clinic for your particular condition or concern. This will give you an idea of whether this clinic is well equipped or whether the clinic is experienced with dealing with these conditions, because a good clinic, or a clinic with experience dealing with that particular condition, will not only just have one option for you. So after gathering all that information, do feel free to go online, do your own research, have a little bit of background knowledge of these potential options the clinic is offering before you come for a consultation with the doctor. And only then should you be asking the doctor, what machines do you have for you to potentially execute this plan. So I think that is the safest way to approach treatments, and this is the same for across all branches of medicine. For example, you don't usually call up a clinic to ask, for example, if you have a Da Vinci robot system, for example, because it doesn't mean that if the clinic or the hospital has a Da Vinci robot system, it doesn't mean that the doctor you're seeing knows how to use it. It also doesn't mean that your condition is suitable for that particular machine. So I hope that makes it very clear to everyone, and I hope that armed with this knowledge, you would be able to make better decisions as well as have a more pleasant as well as safer experience with your next aesthetic clinic and your next aesthetic treatment.